Welcome back, and thank you so much for joining me on Think Like a Nurse 2. Today we're going to be talking about glomerulonephritis. And as we've talked about before, the itis, I-T-I-S, indicates that there is some type of inflammatory process that's taken place, and which is characteristic with glomerulonephritis. We actually have an antigen-antibody complex that has taken place. The immune system has been heightened, and therefore we are having a problem with the specific function of the kidney. The glomerulus actually is where the urine is produced, and in these clients that have glomerulonephritis, they're going to produce urine that has a very low specific gravity, which means that the urine is very, very dilute. Okay, so the toxins and poisons are not being filtered out through the urine. They're actually going to be recirculated into the bloodstream because they're not being removed. So a very low specific gravity is present. We also have to look at our client's physical presentation. And in these clients, they have severe, what we call periorbital edema. We have the eyes, and then we have surrounding, the tissue surrounding the eyes is very swollen and edematous, and that is classic for clients that have glomerulonephritis. These clients also are going to have high protein levels in the urine, and also they're going to have elevated blood pressure. We know that when the body holds on to fluid, that also is going to cause an increase, a rise in the blood pressure. So with these clients, we can expect that they're going to have hypertensive symptoms, and that we're going to have to manage that hypertension. They may present with a low-grade temperature, so not a significant high spike in a fever, but they may have that very low-grade temperature. What we need to think about these clients again is, like I said, that they're going to have very dilute urine. They may present or have an onset of headaches. They're going to have the periorbital edema. They may have red blood cells in the urine. The urine may also show casts. It's going to appear to be a smoky, hazy color. And we got to remember that this is an antigen-antibody complex that's happening. The immune system is actually involved. So in clients where the immune system is involved, we are going to have to, as part of therapy, of course with the healthcare provider's order, go ahead and start these clients on some corticosteroid therapy, so that way we can suppress that immune or antigen-antibody complex to help these clients get much better. Okay, the treatment also can include antibiotics. Primarily penicillin is used unless the client is allergic, and then the healthcare provider will decide on another course of treatment as far as a medication. We're going to have to stress to these clients to have a decrease of protein in their diet, their red meats, peanut butter, cheeses, those kind of things, very high protein. We're going to have to decrease that in the diet because we want the body to be able to recover, and we want the kidney to be able to function normally. Also, when we think about high blood pressure and fluid retention, we talked about the periorbital edema. High blood pressure, we're going to have to decrease the salt in their diet, and also many soups and canned foods and vegetables, fruits and vegetables also have very, very high contents of sodium in them. So we're going to have to limit their intake of sodium as well. They're going to have to be very, very well hydrated unless there's a rationale for them to have to be on a restriction of fluids. Okay, so our treatment for these clients is going to be to start on corticosteroids and immunosuppressants. And in order to get that blood pressure to come down, we said it's going to be important for us to limit that salt or limit the sodium intake. And also we're going to have to start these clients on ACE inhibitors, and those medications are your prils, P-R-I-L. So imagine that we're going to start those clients on pril medication or ACE inhibitors to help decrease the blood pressure and manage the hypertension, help resolve the periorbital edema, and hopefully get our labs back in check. Thank you so much for joining me on today, and we're going to talk in our next lecture about renal failures. Thank you.